everyone. Thank you all for joining us today for our webinar, Engage Your Patients Using Patient Portals and Secure Messaging. My name is Lori Mantefel, and today I am accompanied here by my colleague, Jocelyn Hanslin. Jocelyn and I are both Meaningful Use Project Specialists here at Metastar, and we are working in the Medicaid Health IT Extension Program, and we're very happy that you've joined us today. Really, when we thought about this webinar, basically the goal here is just to help you think about how you can better use the tools you already have in place. We know that there are many challenges to patient engagement out there electronically, and the goal of our webinar, and as we've worked with many of you, is just really how can we go beyond checking the box to meet some sort of compliance for meaningful use, and how to really make this a meaningful part of patient care, and also how to make patient portals and secure messaging a useful tool in your practice. And so with that, our agenda topics are as follows. First, we'll be talking about patient engagement, what are the drivers, and then looking at technological considerations, workflow considerations, promotion of portal usage and secure messaging, and then finally, what is the future of patient engagement, looking at regulatory compliance as well as patient needs.
So talking first about patient engagement drivers, I think it's really important to identify the fact that this is the change management piece. It's not just, like Lori said, not just another box to check, but clearly this is a departure from what you guys are used to. So what sort of office education is happening, what sort of patient education is happening, just like there's typically a physician or other provider champion in the office for the entire electronic medical record install, there also has to be some buy-in at the clinic for the patient portal. Does your staff know the benefits of the portal? Have they seen the portal? Do they have an account? Do they know how to help patients navigating or resetting passwords if they happen to be calling in with issues? And most importantly, do they have a negative view that this is just more work for them and sort of project that to the patient? Can they explain the benefits rather than saying, would you like to give us your email? Or the government would like your email? Or would you like to sign up for the patient portal? Because I think sometimes that is just kind of not a natural word. I don't think if we talked about that to most people, they would be able to say, oh, yes, I know exactly what a patient portal is. You know, you don't necessarily have to project meaningful use terminology on the patients for them to still understand the benefits of why they would want one. Because the reality is that, you know, engaging the patient in many ways is not going to diminish over time. Their expectations are only going to increase, whether it's from meaningful use. Obviously, we'll talk about sort of some future expectations there, but from the patients themselves, I think there's certainly been a rise in demand of information at their fingertips more quickly, not waiting for a letter for lab results and things like that. It's becoming a standard expectation to communicate in innovative ways with providers through e-visits and telehealth and things like that. So that's just going to naturally continue to rise, that they're going to want access to their trusted provider. And this is, at the moment, sort of seems to be the main driver at this time. Again, we'll talk a little bit later about some of the things that might be coming down the pike for stage 3.
And then just to continue on that line that Jocelyn put forward is that in patient engagement, also from a regulatory standpoint, patient engagement is going to continue to be an important element in healthcare transformation. For example, the CMS quality strategy pointed straight to the importance of making patient engagement a top priority. Some of the goals in that strategy included strengthening person and family engagement, promoting effective communication and care coordination, with, of course, the ultimate goal of the patient owning their own health information and really to make care more affordable by making better choices. Now, all of this is very reflective of the progression from a paternalistic, if you will, approach of basically do as your doctor says to do to a more collaborative approach where healthcare providers work together with patients to determine the correct care plan that the patient can buy into as well. In terms of meaningful use compliance, and later on I do have links directly to the spec sheets, but there are two objectives currently in place that are not expected to go away, that is for sure, and one of them is the objective around patient electronic access, or VDT, view, download, and transmit, as well as secure messaging. Right in the objective for meaningful use around the patient electronic access is that the patient is really to allow patients easy access to their health information as soon as possible so that they can make informed decisions regarding their care or share their most recent clinical information with other healthcare providers and personal caregivers as they see fit. So just very top-line information, but in 2016, 50% of patients must be provided access to view, download, or transmit their health information through a portal, and one patient needs to actually go ahead and access their patient that way. And in 2017, that is increasing to 5%. Secure messaging also, if I may comment on that, is a great example of the progression of patient engagement from a compliance or standpoint. And that is in 2015, meaningful use requirements simply required that secure messaging be functional, be enabled. 2016 requires that at least one patient send or receive a secure message, and for 2017, the objective is that providers communicate with an increasing number of patients. And so just moving on to the technological considerations, and just and first of all, I think we all think about the limitations first, and there most certainly are them, but what I would like to challenge each of you to do today is think about the tools that you currently have and how you can use those to work and improve to improve the patient experience as well. So when you think about portal customization, think about understanding what is visible to the patient. Have you or your staff, and especially the staff, actually look to see what is visible to the patient? Do you understand in your EHR what fields directly go into the patient portal? And if there is any customization possible, how you can do that? Also, thinking about allowing scheduling, viewing, canceling of appointments whenever possible, asking your vendors if that is available, when it will be available, those sorts of things. And then enabling mobile access if the portal has that option. One other point that I just wanted to emphasize here is also knowing how to use the portal, where the instructions to be made available either through print or on the website, or in the best of both worlds, both. Also, when you think about technology, it's important not to forget about the privacy and security considerations as well. Meaningful use, objective number one, is still, and it's actually moved to objective number one, and that is protecting patient health information. And as we move more and more into the digital side of engagement, that becomes more and more important and something to definitely think about. But also we need to go beyond that and think about what kinds of policies to have in place that are very specific to electronic engagements. For example, how will information be handled as a clinic for 12 to 17-year-olds? And also working with your compliance personnel within your clinic to ensure that the corrective information is relayed as determined. Once again, that's determined really by your own organization. Another example would be what info can and will be shared in a secure message versus, responding with a, we will be calling you back with this information. And just knowing how you're going to handle electronic patient engagement.
So Lori just spoke about some of the technological things to consider and talk to your vendor about. As far as workflow considerations, we're shifting our focus a little bit to more about working with the staff and sort of assessing how exactly, in all reality, this is going to happen in your office. So, as I mentioned before, staff training is really important so that they know what the benefits are, but more practically, who's assisting in signing up, who's doing the education of what those benefits are. I've seen quite a variety depending on the clinic, depending on the size, depending on if it's a specialty. Some do that at check-in, some do that when they're getting roomed, some do that as they're wrapping up. I think Lori pointed out too, like having instructions on how the patient can access that information. And some of that may or may not be part of your vendor information with regard, I've seen there too, again, different ways to sign them up. Some vendors that I've worked with require a provider to invite a patient to participate. Others say, here's the portal, just go ahead and sign in and make your own login and password. So it can really vary. So sort of a general awareness of what's the procedure? How are we feasibly going to get this done? And I think that also goes back to our original piece about change management. So now that we start to get them to accept and embrace that this new paradigm is really upon us and it's not going to go away, I think once that workflow becomes more natural, it's just going to be, hopefully someday, the same as taking vitals or double-checking demographics and things like that, just standard of patient care kind of thing. One thing that I've also worked with specialists in particular, they generally have a heads up that someone's been referred to them. So I understand that's not always the luxury that primary care providers have, but they actually send out sort of a welcome packet for their patient and say, here's who you're assigned with, fill out these forms, on and on. But then they also include a flyer about the patient portal, how to sign up, what are the benefits. And those are things that you can absolutely hand out in clinic as well, or have them hanging in the exam rooms. Again, I think some studies have shown you need to see something 7 times for things to actually register and stick a little bit. So I don't think that we can under-promote this in any way. And again, using language that makes sense to the patient. You wouldn't have to say patient portal. You could say, hey, would you like to see these things online? Again, in alliance with what your vendor is capable of, as Lori pointed out. The other piece Lori touched on a little bit with regards to the privacy and security piece is that you might want to streamline some of these workflows. So not only for greater efficiency, but also, the second bullet point says respond promptly to secure messaging. Well, as an office, you're going to need to know or determine what does promptly mean and communicate that appropriately to your patients. So we'll respond within 24 hours, or it's going to be, 48 hours, or it's going to be within 3 business days, so that they have a realistic expectation. I know the patient portal that I use regularly, every page I go to, there's also an alert saying, if this is an emergency, please don't send a message, call 911. So, again, kind of setting expectations that, this can sometimes be used in place of making a phone call. I can log in and I can see my lab values rather than having to call you guys. But, if I'm having chest pain, I shouldn't be sending a secure message to say, what should I do? Would you like me to go to urgent care or the ER, or should I come in for a visit? No, we just really need you to use more of the common sense. That's not really the point of the portal. And, someone may not be reading that initially. So those are some helpful tips, I think, that people don't understand when they're actually trying to put this into practice. And then again, upon checkout, you can always remind patients of this availability as well. Another important workflow consideration, and goes back to working with your vendor, is understanding how they calculate this idea of access within 4 business days. Again, vendors vary in many ways on how to do that. The easiest way for most vendors is to just verify that an email is associated with that patient, whether it's their own or whether it's a proxy. If I'm a proxy for my parents, then I can log in and see what's happening for their care. That's not, I think that the Federal Register, the 2015 to 17 rule, made it very clear that that was not the intent of that particular measure, was to gather email addresses. It was to make the information available as to how to access the patient portal, how to log in, things like that. So I think it's a really important conversation to have with your vendor so that and it kind of goes back to, I can't streamline a workflow if I don't know what workflow is expected of me by my vendor. And again, it sounds a little, let's make sure we're checking the box, but, the other piece is if you don't meet it, then you're not going to pass meaningful use. So I think that's an important piece. And if you have more questions about that, certainly feel free to reach out to us. We've had some pretty creative ways to work with that and address more of the access situation than the email situation. So Lori and I will have our contact information up at the end of this presentation. So, and again, as I mentioned, creating policies around the portal functions. How are the patients made aware of the portal? What are the expected response times, workflows? Those are all important things to start having on record.
And then next, I wanted to talk a bit about promoting the portal usage. And first of all, let's just make clear that, there are always going to be patients without access, especially as we speak of the near-term future. But I'd really challenge you to think about the opportunities for those who do have access, or also for people who are managing chronic health conditions and how this could be of benefit to them, as well as many elderly have families that many times are quite a distance away that are trying to help manage and are proxies, and they're trying to help family members that live out of state or some distance away, or are just simply trying to help manage especially chronic conditions. And so I think really making sure that patients understand what information is available, and almost more importantly, when they should use the portal. And then providing a handout outlining what the benefits, or even more importantly, what is available, so that, once again, speaking to what Jocelyn brought up, it takes multiple times for people to really understand that, and especially to to change habits. Include signage throughout your clinic so that it's something I've seen different practices even have it right in the exam rooms so that it's something that they can talk about during the appointment if appropriate. And then suggest that patients access the portal for specific information. For example, let them know, your lab results will be available within 4 business days. If you have any questions, please feel free to call or send, a message, those sorts of things. And also really, in speaking once again, this is a little bit to what Jocelyn had just talked about, but knowing who in the clinic will be able to help answer questions and assist patients with any questions that should come up relating to the portal and how it's set up. So sort of knowing who would be handling that. Then on to secure messaging. I think this is one thing that I've seen clinics sort of struggle with, really deciding as a clinic when patients should use secure messaging because according to compliance, they need to use it. So you most certainly want to let them know the appropriate ways of using messaging and how and who, how that works in your clinic and how you will respond to both secure messages that are appropriate as well as secure messages that potentially aren't appropriate as well or need to be followed up with either through an office visit or you need more information through a phone call, those sorts of things. And then also, as we've said before, just ensuring a fast response time. Make sure that these are being triaged and that patients receive a timely response. And once again, knowing who, if a patient does have questions about how to use secure messaging and to send their providers a message, really how to use that and who that person would be at the organization.
Looking ahead, there's generally the same measures and the same thresholds that we're going to need to follow for stage 3. But they do also include some other more innovative ways to engage the patient. So the patient health information capture, they're suggesting things like, can we hopefully start to integrate maybe a patient uploading information from their blood glucose meter. The application programming interface, I wouldn't say necessarily eliminates the view, download, and transmit, but sometimes that can be kind of clunky, and if people don't know exactly how to get that done, what they're talking about with these application programming interfaces is it could be maybe an app on your phone or something that's a little bit more, I don't want to even say user-friendly because there's such a wide variety of capabilities with view, download, and transmit, but the idea is to empower the patient to receive information from their provider in a way that's most valuable to them. So if I'm usually on the go and I'm not on my laptop, I would really like to be able to get some alerts to my phone. So things like that. So I think that there's going to be a lot, open for interpretation. I don't think there's a ton of guidance on that other than, of course, it still needs to be secure. But overall, that there's a lot of leeway to start to meet those patient needs. Personal health records are becoming more and more important. Again, those are independently patient-owned. They're not necessarily affiliated with any particular organization, so it's just sort of my own data of keeping track. Like back in the day, I remember my dad had spreadsheets that for each one of us children, like here's, yes, they sprained their ankle this year, but they had their immunization and kept track, and now, 20, 30, 40 years later, we have personal health records that can do that and that he could access from anywhere if that's what he chose to do with his time at this point. The device integration would be more of things like your trackers, your Fitbits, your things like that, so that we could upload some of that information as well. Potentially, you know, as you plug that directly into your computer, it could upload automatically, so it's more integrated than hand entering anything, and that all of those things start to become a standard of care. That's, you know, and I definitely think the face of patient engagement is going to look significantly different in 3 years than it does now, and I think that change is just going to continue to happen. So the patient engagement from a patient perspective, I enjoy this job because I kind of get to see both sides. So I'm the patient that I'm talking about. So I've had extensive patient experience. So I'm completely bought into this whole idea of patient engagement. Lots of different complications, lots of different specialties involved. I used to have to sort of coordinate everybody and say, okay, I just saw this doctor. He wanted me to tell you this. And then I saw this doctor, and he wants me to tell you this. And so I was coordinating my own care, and we're talking like a good 6 specialties, so from a wide variety. So I love the fact that I can log on to my patient portal. I can pretty much copy and paste the same message and send it to all of them. I would love to be able to send one message so that we can have a group conversation. I'm able to do that any hour of the day. I don't necessarily have the expectation that they're going to respond to me immediately because of some of the complications, but and then I can also share access with my power of attorney for healthcare, who happens to be my wonderful sister, who's an OR nurse. So I get a different, you know, objective, well, as objective as she can be, perspective on that as well. So without having to call her and trying to remember every detail and update her. It's also really helpful for me for a historical view of events, because it's really difficult to keep track of things. And there are also things that I was not awake for, that, you know, there were complications in which I just wasn't as alert as I would be ideal to remember anything significant. So I think like I said, I'm kind of a tough sell there, but aside from my personal experience, you know, I did a little bit of research here to find out what are the trends, and why does patient engagement matter to someone more than me? The reality is that patients with chronic conditions and multiple comorbidities are on the rise. The estimate is that in 2020, there'll be 157 million people with one chronic illness, and also by that same time, there'll be 81 million people with multiple chronic illnesses. And most of them see at least 4 different physicians in a year, so 4 different specialties to help manage that care. So there's definitely going to be an increased need for care coordination and management, as well as monitoring their care. And again, back to, you know, other caregivers, and, you know, the care coordination isn't just necessarily your care team, it's every piece of your support system that needs to be on the same page to know what needs to be done, what prognoses are, and things like that. So as Lori said earlier, you know, as much as I love patient engagement, I realize that there are challenges. I realize there are challenges within the communities. I realize there's challenges based on certain populations and their level of access to that. So I think these are 2 really common ones that we hear as meaningful use project specialists, that, oh, well, yeah, our patient population, they're just not interested. And I think we'd like to challenge people to think, you know, is that an excuse, or are those actual true reasons? Like, can we look at it a little bit deeper and say, are they not interested because you said, hey, can we have your email? You know, is the value clear, or are they hands-off in their care? And then we go back to the whole idea of change management, where we need to start engaging them in other ways. And, you know, maybe in 6 months or a year, we'll build up to getting them signed up, but part of it is selling them on the idea of some ownership of their health and not necessarily just leaving it to their caregivers, very similar to how people do retirement funds. Like, oh yeah, there's that guy or that woman that takes care of that for me, and I'm sure that'll be fine down the road. I think people sort of treat their health in some ways and say, well, the doctor said X, Y, Z, and I would rather not do anything more. I'll just listen to what they say, and I'm not going to get engaged. So I know a lot of folks, as I mentioned, also said they don't necessarily have easy access. Just some suggestions is there a way to have computers in your lobby? I know that's not ideal. It doesn't give them access 24/7, but, you know, maybe if they're there with their children or with another loved one for an appointment, they can check on their own information while they're there. Or maybe can they take some time when they're in the clinic to actually sign them up? If they're not interested in participating, can we educate them about proxies and say, well, you know, do you work with other people? Do you have other caregivers that might be interested in that information? I know that back when we used to hand out the clinical summaries, people thought that was fairly useless. I remember that argument then too, just sort of oh, everybody just throws those away. And then I talked to a few people who said, oh no, when we take my mom to her appointments, we take that clinical summary, we put it right on the refrigerator, because if she falls or if an ambulance picks her up, they grab it and they go on their way, and they have the most recent information. And that, true, in reality, I did the same thing. Just a couple of months ago, I was just like, okay, having some issues here. I can't quite articulate what was most recent, but here's my most recent clinical summary. So, and they were like, oh, great. This gives us at least a place to start as we load you into the ambulance. So,
and
Lori, do you have stuff to add?
Yeah, the one other thing that I also wanted to add, you know, is that don't think about necessarily all, but think about how you can do more. Because there are patients who, you know, slowly but surely are moving on that progression of change management and understand this and do want to be interested. And the same is true of access, and especially for family members and proxies and things like that. So there's no one size fits all, and you know, the thresholds that we have to meet, while they are increasing, once again, they are still hopefully within, and hopefully the CMS will continue to try to keep it within reason as to what is possible within our geographic areas as well. So that's one thing that I think of when I think of this, is how can we do more? Not all, because not all patients will have access or are interested, but for those, you know, what can we do to create that interest, and what can we do for those who do or will have access?
So we wanted to make sure to give you our contact information so that if you have questions or need assistance from us and aren't sure who to reach out to, please feel free to email us directly or call our main number and ask for either one of us. And then the last page of the PowerPoint includes some of the links to some of the information that we shared for today.
Exactly. Thank you all once again for attending our webinar today, and Jocelyn and I are available if you do have any questions or concerns that you'd like to bring up. Thank you.